Hello, happy Saturday. Today I wanted to talk to you about some questions that I've been getting from um, folks in the group as well as outside the group. And the question is, along with what's my optimal dosage supposed to be? Dr. Bihari says 1.5. Should that be my optimal dosing? Um, and I think you've heard me talk and post enough times that optimal dosing has to be individualized. That's because the way low dose naltrexone works, part of the mechanism is endorphin blockage. And if you don't have a lot of endorphins that you have access to and you block them suddenly, that person is going to feel miserable. And one of the questions I got was that I feel headache, I feel fatigued, I feel my emotional distress is worse. Or the worst case would be like I'm getting cold sweats as if they're having endorphin withdrawal, and because they're probably having that. So we've answered that question saying that optimal dose is a myth. You need to figure out what your optimal dose, and the best thing to do is figure out what your endorphin reserve is like. I'll give you an example of high endorphin reserve. That's like when you're 18 years old, you don't have to sleep, you don't, or you need very little sleep. You stay one night, no problem. And then low would be you're in pain all the time. You can't get well rested sleep. When you get up, you're not ready to go. You feel tired. And then middle of the day, you feel like you need a nap. At the end of the day, you feel like you don't have any more energy left. Those would be examples of low endorphin reserve. So depending on your endorphin reserve, you can start high. If your endorphin reserve is super high, you can start higher dose, including 4.5 milligrams. But if your endorphin reserve is low, you need to start at appropriate level, and that's more art than science. So the second question that I got was that how long do I have to stay on this stuff? So my standard answer is it has to be individualized, but it's a personal choice question. The textbook answer about immune modulation is 5 years. Allergy therapy or allergy immunotherapy for allergy reversal is 5 years. Cancer, you need 5 years of cancer free, no evidence of disease before they'll say you're in remission. Why is that? I think that they have made a convention for immune system. 5 years is kind of the term. So the next follow-up question is that 5 years is minimum, then do I have to stay on this stuff rest of my life? I think that's a personal question. There are people who will experience, a majority of you will run out of medication, you may lose the medication, something will happen, and I call those natural experiment. What happens when you get off LDN accidentally? And some people say, oh my God, that was the worst thing ever, and I'm never doing that again. Some people say, I'm not sure what LDN is doing for me. So I think those are natural experiments. I prefer natural experiments than not. But I can say majority of people who take LDN, they're not really interested in getting off because it has improved the quality of life. But if you need to find out, I would say that natural experiment would be better than you doing your own experiment. Maybe talk to your clinician. I think it's better to work with a clinician than just go to someone who prescribes LDN and does not have any background in LDN because that person is not a resource. It's just a pill writer. So, um, happy Saturday. I hope you guys have a fantastic weekend. I think I'm going to call this video um, how long before I see effect and how long do I need to take it. And I really appreciate all the members for the LDN support group. And if you like this video, please share with somebody that might benefit. And then if you like the content, give me a like and consider subscribing and hit the bell so that you'll be notified when the new videos are made. Thank you.